My name is Aidan Murphy and I'm the Project Manager and Clinical Coordinator of Jigsaw Kerry. I qualified as a mental health nurse in 2001, and at that stage an awful lot of the onus of mental health was around cure for mental health illnesses. There was very little talk about prevention or early intervention. We tend to talk far more now about mental health as opposed to mental illness, so we are trying to change the topic of conversation. I think young people in Ireland are leading that change. I think they want to stand up, be counted, and really discuss mental health at an earlier area and an earlier time. Also, I do think that people who have gone through some mental health issues are learning to live and cope with their issues an awful lot better than perhaps what they had been doing maybe 15 years earlier. There are now an awful lot more support services available with other health professionals such as occupational therapists, psychologists and social workers. We're now moving away from the medical model of medication for every issue, and we're far more advocating talking as a therapy and as one of the supports in dealing with mental health issues. There's still very much a stigma attached to mental health in Kerry and in Ireland. I suppose people are afraid to be labelled as bad or depressed or alcoholics or some term like that. I do think, however, that particularly with strong messages coming out of people in the public eye saying that they have gone through some mental health issues themselves, that quite a bit of the stigma is now starting to be removed. But I do think that the terminology that we use doesn't help in terms of stigma, particularly madness, badness, expectations of having to go to hospital every time you're not feeling great. They are the huge stigmas that are still attached to mental health in Ireland. I'm glad to say that the likes of the old hospital institutions have now closed down, so that stigma has been removed. But the thoughts that you have to go to hospital every time you're going through a tough time, we're trying to slowly but surely change those so that people can remain treated in the community, in their own homes, so that they can get better much quicker, supported by their own family members. The advice I'd give anybody is 99.9% of us in our own lives have one person in our life that we can confide in, one good adult. So that could be a friend, a teacher, your parents, your husband, your wife, could be even a son or daughter. I would say trust in one person that you can feel free to disclose and talk to them if you're going through a tough time at any stage. And also know the signs and symptoms of when you're under stress, and know things that help to kind of to detract away from that stress, like going for a walk, not drinking alcohol at a time when you're stressed out. Just knowing how to mind your mental health, I think, is very important.